Sarah, I am so pleased to see you.
Lovely
You
to
have spoken, I think, at, well, it was first the dog bite conference, but the dog behavior conference for years now.
long time. Yeah, I've enjoyed it. It's a highlight of the year. It's a good
It, it,
conference.
it's truly, I mean, every single time you speak, we all learn something and you blow our minds. And that's why you're back again by popular demand. Today, we're going to be talking a little bit about your presentation, which is focusing on pain in dogs and how pain maybe can cause behavioral change. And if you see behavioral change, is that linked to pain, chronic pain, or acute pain? But I think chronic pain is harder to see. And I think this is vital, especially when we are seeing dogs that have pretty severe behavioral change and maybe are exhibiting some kind of aggressive behavior. But guys, if you want to listen to Sarah Heath's presentation, then you have to register. So please register for the Dog Behavior Conference, dogbehaviorconference.com, April the 1st to the 3rd. It is online. It doesn't matter where in the world you are. Please join us for an amazing 3-day conference. And if you can't be there live all the time, I do not expect you to, because it's we've got a lot of presentations. Then you have access, once you've registered and the presentations have gone out live, you have access to the presentations for 12 months. So get registering, guys. Okay, Sarah. When I first started as a trainer many years ago, I won't say how long ago, but it was a long time ago. I saw and still see so many dogs that are exhibiting aggressive behavior. And as I have evolved in this industry, I am more and more sensitive to behavior being caused by some underlying pain that cannot be easily seen. Discuss.
Yeah, I think one of the things, important things to say are that pain can contribute to behavioural change in many ways. So it doesn't only contribute as the direct cause of a behavioural response, which it can do, but it can also contribute to emotional lowering of your emotional capacity, which means then you're more prone to show other behavioral signs because you don't have enough emotional reserve to deal with the challenge. So it can have an indirect effect. So I think that's quite important to remember, that it doesn't have to be a direct causal link. I think the other thing I would say as well is that although repelling or confrontational type behaviors, which are maybe colloquial lay term calling it aggression, but aggression is a difficult word.
It is a difficult word, very difficult.
Defined. It doesn't really mean much on its own. But if you've got a behavior which is repelling, so trying to make something go away, or if it's confrontational because of frustration, those things can also be complicated by pain. So you can be more frustrated because you have a painful lesion. So something's causing you pain, and then you have the desire-seeking system to go and get a ball, for example, or go and get food or get into a comfy resting place, but you can't do any of those things as quickly or as efficiently as you'd like to because you're in pain. Then you may become frustrated because of that, and it may be the frustration that's causing you to be confrontational, not actually the pain itself, but the fact that pain is limiting something else that you want to do, that makes you frustrated, and therefore you're more confrontational. So this complexity of the relationship, I think, is something we really need to try and get a better hold on. But also, because pain itself is an emotion, it's not just a physical sensation, it's also an emotion. That also means that because it's one of the protective emotions, one of the ones that's ranked as negative by PANCSEP, that protects the individual, that means it can lead to one of 4 responses. So it can lead to repelling, causing you that more confrontational or so-called aggressive behavior. But it can also lead to avoidance, again, that might be obvious, the animal trying to get away. And it can lead to those less obvious changes of inhibition and appeasement. So inhibition is a behavioral response where you shut down and just gather information to try and make yourself feel more comfortable. But those animals can look like they're very calm. They can look like they're not doing anything. They can look like they're not disturbed by what's going on. So that can be quite confusing. And then they can also show this appeasement, this gathering actively of information from somebody. And those dogs can be misinterpreted as being really friendly or being really happy. And so it can be really difficult to determine when pain is involved, because it doesn't always present as a confrontational response. And that might be the thing most people associate with pain, because something's in pain and it snaps at you, you kind of think, okay, I understand that. But if something's in pain and it does one of these other behavioral responses, that may not be quite so obvious.
If somebody suspects that something is going on that they can't explain, what should they do? If they don't understand or they're concerned, what do they contact a trainer? Do they go see a vet behaviorist? There aren't a lot of you around. I wish there were more. Do they go see their vet? What do they do?
Yeah, I think most important thing from a welfare perspective is if ever there's behavioural change in a non-verbal, non-human animal, it's absolutely essential to see a vet, because of the fact it's not just pain. We're talking about pain now, but obviously there are endocrine disorders, there are heart problems, there are blood pressure, hypertension issues. All of those things can cause a change in behavioral output and what you do. So because these animals are dependent totally on us humans for their welfare, it's absolutely essential that if there's a change in behavior, the first thing you do is see a vet to make sure there isn't some sort of underlying physical problem. Now, obviously, the GP vet can screen for those things that are obvious, those things that are common, those things that are likely, and that obviously will take the majority of the ones where there is an underlying medical condition, hopefully will be picked up in that way. That doesn't mean that every single case will be picked up at that point. And that's not because there's a problem with the GP vet. That's because sometimes it takes time to identify what the underlying problem is. And that's why if you are then going to instruct the help of a non-vet working in behaviour, of which we have some fantastic colleagues who can offer a wonderful service there, it must be a joint approach from that point on, so a dialogue, because the non-vet may well be able, as they're looking at the progression of the behaviour, go, something's not right. They won't be able to tell you what's not right, but they will be able to tell if something's not following a normal pattern or something's not responding in the way that their experience tells them that it should. And therefore, if the good dialogue is present, they can go back to the vet and say, something doesn't feel right, something's not progressing right, and the vet can then go further with investigation. So it's a team approach that's needed, with the first port of call being the vet because of welfare, because this is a non-verbal, non-human animal who's dependent on us. So that's the only reason that it has to be a vet-led team, is because of welfare and making sure we're not missing something, but then making sure we work together in a really good bilateral dialogue, in the true sense of the dialogue word, that we're actually talking to one another in a respectful way and in a way that makes sure that both parties are actively involved in the case, because chronic pain can be very difficult to diagnose, really difficult to find. Some advice to vets would be that you really can't diagnose chronic pain in a consulting room in a 15-20 minute normal consultation. It's just not possible. So there needs to be more investigation. We use a lot of video footage of the animal at home, or the animal walking on different surfaces, or maybe going up and down stairs if we're looking for osteoarthritis or degenerative joint disease. And the other thing is to remember that chronic pain is not always about joints. We tend to think about joints because that's common, A lot of animals do have OA and degenerative joint disease, but chronic pain comes from all sorts of sources. It comes from the mouth, it comes from your guts, it comes from skin, it comes from soft tissue injuries, muscles and tendons, not necessarily joints. So pain can come from a variety of sources. So we need to be really careful when we talk about chronic pain. We don't just mean joint disease, because that's not the only source.
So when person has now taken their dog to the vet and everything comes back, all of their blood work, everything comes back normal, yet still seeing something that's just not right. What is that next step? Yes, videos sort of taking a longer view, maybe going back to your vet and saying, there's something not right. Where do you come in? Where does the other animal care professionals come in? When does somebody go, okay, the vet's not, but there's still something going on here?
Yeah, I think this is the point where we might seek the help of a physiotherapist, for example, who might be better placed to identify soft tissue related discomfort, because they are particularly skilled at that. Maybe that we use other types of equipment. So in our practice, we have a veterinary physiotherapist as part of our team. We also have a stance analyzer, which is a machine that helps to look at the weight distribution through the four limbs so that we can see whether there's an abnormality of weight distribution. And that can be seen sometimes when the changes are very, very subtle. And obviously other things we can think about are looking in more depth about other potential sources. So looking in the mouth, taking a gastrointestinal history, looking at the skin, not again, always thinking about gait and lameness and joints, but thinking broader than that. And then eventually, if it's justified, then a trial of analgesic treatment can also be very helpful. So we call them an analgesia trial. We give pain relief medications for at least a month in order to determine whether or not there's a change in behavioural response from that. Another thing we have to remember, though, is pain is an emotion which is related to fear and anxiety. They are part of the same system. And one of the things that can also happen is that if you're in a state of what we call protective emotional bias, so if you have more protective emotion than engaging emotion, the way in which your body is responding to that emotion, so you're more anxious or more fearful, will change your brain's processing of the physical element of pain. So your pain perception changes. So for an individual who is anxious, that the pain from exactly the same problem, so whether it's their gut or their mouth or their joints, the individual who is anxious will have a more significant contribution of pain. So their perception of the pain will be different to an individual with exactly the same physical condition who is not an anxious individual. So we've got to also remember that it may also be an interplay between the physical and the emotional health of the individual that means that pain for this individual is actually significant, even though if we just looked at x-rays or we just looked in the mouth and looked at lesions, physical change, we might not expect that to be particularly painful. That's why in human medicine, human medics say that pain is always what the patient says that it is. And we say in veterinary behavioural medicine that pain is always what the patient expresses that it is. It's what that individual says through its behaviour, through its body language, that determines whether pain is significant, not what's wrong with it physically.
Are there more? Yeah, take a drink. That's are there more? So what are some subtle signs of pain? I do remember the first time when Jasmine, my Chihuahua, looked like she was forming a bridge shape. like this. And I was like, do you have a stomach ache? Because if I felt like she was pain guarding her stomach. And so we gave her a little bit of medicine and she straightened out. And since then, I spoke to the vet. And since then, I know that if she goes like this, then she is pain guarding. She does have stomach aches. So we've been able to treat that. But what are some subtler signs that your dog might be in pain?
Well, those things that we were talking about before, those passive response of withdrawing, not engaging. Sometimes we are always looking for something present, but the absence of things can be just as important as the presence of things. So sometimes it's what they're not doing that is actually the indicator that something is not quite right. And I think caregivers, those of us who live with companion animals, we know our animals very well and we're with them all the time, and we notice subtle changes that wouldn't be obvious to anybody else. So the caregiver is actually the person in the best position to identify that something's just not right. I don't know what it is, but I know that for this individual, that presence or absence of a behavior is just not normal. That's not what I would expect. You knew that Jasmine doesn't normally look like that. That's different. That doesn't look the same. And so caregivers are in a really good position to notice really subtle things. And what's important for us as professionals, whether it's us as veterinary surgeons or people like yourself as behaviour and training people from a non-veterinary background, it doesn't matter. Those of us who are professionals, who are working with caregivers, I think the most important thing is we listen to the caregiver, because they do actually know those animals better than we do. And if they're saying that they're seeing something that's unusual for that individual, then we have to assume that it may be of significance. Yes. Not just
don't dismiss it. Don't dismiss it. Listen.
Yeah, absolutely. Even to the things that sound to us as professionals as if they're nothing. That's like, that sounds really insignificant. But if it is significant enough for a caregiver to have noticed it, then it possibly is significant enough for us to take seriously from a professional point of view.
I know what I feel like when I have felt pain, or when I've had pain that's lasted more than a day. And I either just want to take myself away and nobody disturb me, or I do get more emotional. I get more sensitive, definitely, to light, to sound. And there is a link, isn't there, they're saying that there is a link between noise sensitivity and pain.
Yeah, definitely. We don't know the exact mechanism behind that link. And again, we need to be careful always in science when we talk about correlation, that correlation is not the same as causation.
Yeah.
But certainly there's a correlation, and there are many potential reasons for that. One, as you've just said, is that there may be a sensory change in an individual who's in a situation of being painful. There's also this idea, using the sink analogy that I use, that you've got less emotional space and that's less emotional capacity available, because pain is like a dripping tap. It's like a chronic pain is like a dripping entrance of emotion, which is taking up space. If that's the case and you've got less capacity, then when that noise happens, you're more likely to show a reaction to it, potentially, if the input that comes when the sound happens pushes you to your threshold quicker, because the pain is already taking up some of your space. And the other possibility is that if you are in pain and you have a sound related fear, then if your reaction to sound is to want to avoid, so if avoidance is your response, you want to move away, but when you hear the noise and you attempt to move away, you hurt, then that hurt can be linked to the sound through associative learning. And then your perception of the potential for that sound to be detrimental to you is exacerbated, because now not only does it frighten you, but it also makes you hurt. then you're going to have a much stronger emotional response to that sound in the future. So that's just 3 potential reasons why sound and sound sensitivity and pain may be linked. So this relationship is quite complex, and it doesn't matter for the individual which of the reasons it is, because it results in a link. And certainly the most important thing is that we think about pain when we have a presentation of a sound related fear, but not just that. I mean, when we have a presentation of any behavioural response, then pain is on the list of what we, in the veterinary profession talk about as differential diagnoses, the potential reasons. Pain is on that list.
There are going to be a lot of trainers coming to this conference, and I for years, I mean, when I was starting out in London and then in Manhattan, I formed relationships with veterinarians all over the city, and then in New Jersey, all over there, so that I was able to communicate with them and be part of a team. The veterinary behaviourist is also an essential part of that. And as I said before, the veterinary behaviourists, there aren't as many of you as we would like. But how can that enhance a relationship? When does the veterinary behaviourist come in? So you've got the trainer, the vet. Now we've got the vet behaviourist. When do people call you?
I think often vets refer to us, obviously, because we're at referral level. And so the vets often refer to us when they are not sure about the link to something physical, or when they're pretty sure there is a link to something physical, and therefore obviously we can look at both. And within our practice we treat chronic pain as well as behavioural signs. So we treat emotional reasons for behavioural change, and we treat pain. So, and of course we are able as well to identify things like gut disease or oral disease and those sorts of things as well. So when we're looking at a behavioural case, we're looking at it in its entirety of physical health and emotional health. And that's the other difference, is that when emotions are actually abnormal, that is also veterinary based. So when those emotions are not within the realms of normality, when they've started to become abnormal, that's because neurotransmitter levels are abnormal, and that's in the realms of needing medication in order to treat an imbalance of those neurotransmitter levels. That is something, again, which is veterinary. So I think the veterinary behaviourist role is in emotional ill health and physical ill health, which is leading to behavioural change. Some of the animals who present with behavioural change where the caregivers are concerned, of course, are physically and emotionally well, but cognitively they are not functioning. So they haven't learned correctly, or they've learned inappropriately, or all those sorts of reasons. And that's a bit like the relationship between, a teacher, an educational psychologist, and a GP. They're all people involved in caring for the child, but they're caring for that child at a different level, in a different way, and none of them are more important than the other. The teacher, the educational psychologist, and the GP are equally important, but they each do a different thing. And without all of them working together, the child's welfare is not best served. So the same with a dog. That dog is absolutely well, physically and emotionally, and then a very good trainer can deal with the cognitive side, the learning, the educator, if you like. And then if that animal actually has psychological challenge because of the environment it's living in, but is emotionally well, then that individual may do very well with a non-veterinary behaviourist who can help to deal with the emotional challenge of an environment that's not quite right, the educational psychologist. Or it might be that that animal is actually emotionally really unwell, and therefore needs in the child's case would need a psychiatrist to be involved, because that's emotions become outside of normal limits, and therefore the veterinary behaviourist would be involved for the dog. And then the GP or the specialist would deal with the physical health issue depending on what that physical health issue is. So it might be that a GP will deal with that, or it might be the child needs to be referred to a consultant at some level in order to deal with that. So I think there are quite a few parallels between the way that, children with challenges in terms of their behaviour are being assisted through different multi-professionals from different backgrounds. The same goes for a non-verbal, non-human animal who also needs to have multidisciplinary help to deal with whatever it is that's challenging them and leading to behaviour the caregiver's struggling with.
You always make things exceedingly clear. And I think that's why, apart from the amazing information that we all need to know, but it's the way you present that information that's the reason why we always love having you back here to make something that is truly complex, really complex, understandable. So, Sarah, thank you so much for talking with me today. And I cannot wait till April. I cannot wait for people to hear your presentation. Everybody, if you haven't registered yet, register dogbehaviorconference.com, April the 1st to the 3rd. It's online. Doesn't matter where in the world you are. Please come and join us. It truly is a wonderful, inspiring 3 days. Sarah, thank you so much. Really appreciate it. And we'll see you in April.
Yeah, see you in April. Look forward to it.
Okay, bye.
Bye.